we are in space and stuff like that, but I like to use red for muscle, black for bone, and then if we're in a part of the body where there's like nerve or artery, we can use one of these other colors. And there's tons of markers, plenty of markers. Okay. This is meant to be kind of just a quick exercise in where stuff is, where we're going to needle. We're going to start at the top and work our way down. Okay. You guys make sure you get where you can see. So on the back of the skull, there's a bump. You guys know what that bump is called? Yeah, the occipital protuberance. And then, you're fine, you're fine. Get it up there, get it up there. And then y'all hold it. Like, give it a little twist. One second. We get. You're fine. It's like the flimsiest thing ever. I borrowed this from a friend, so there we go. Okay, cool. We'll probably have it better than next time.
Oh, thank you. Sanitation.
There's a princess in every crowd. I'm just kidding. This is better. Okay. So, from the occipital protuberance over to behind the ear, you guys feel behind your ear. What's that big bump there? Mastoid process. Okay. So if you look at an anatomy book, or the pictures in your lab manual and stuff like that, you'll see that from the middle of the skull to the mastoid process, we have several of our suboccipital muscles sitting right underneath. We're going to call it the occipital shelf, because if I take my fingers and then they fall off, and then I can kind of curl them under the occipital shelf. So that's the occiput, and that's where those muscles are, and that's where we want to needle. All right, so I don't want to be needling here where it's like flat, and I don't want to be needling here, not yet. I want to be needling up onto the occipital shelf. All right, so you guys don't have to draw up here, but if you want to give yourself a little landmark, right, there's the middle. There's my mastoid. All right, I don't even think y'all should draw this, but I'll do it for y'all. So now we've got from here to here, right? We're going to divide that into three equal parts, and you'll see that anatomically that's going to line up with our suboccipitals that come and attach right there. So I would say 1, 2, 3, right? I usually just go ahead and needle all 3 spots on both sides. However, if you decide you want to just poke around, and wherever you feel like hypertonic tendon like this, if you guys haven't felt like a hypertonic muscle and tendon, there's a really good one right here. You can come and feel it. Anybody want to feel that? Are y'all good? Come and feel that. That should not be like that. That's like crazy hypertonic. Yeah. And she's not turning that on.
You okay? You good?
I am good.
Yeah. And gentle pressure, like just enough to get the job done, right? That's really important. Don't be like super hard, pokey fingers.
Ooh, it feels good. Y'all should y'all keep doing that. Go for it, please.
So suboccipitals.
Is it tight on the other side too?
1, 2, and 3. Okay, is it tight on the other side? Not so much. A little bit, but like not. It's not. That's not insane.
It does feel different.
Yeah. Okay. So suboccipitals 1, 2, 3. I'll show you guys how to needle those in a sec. You have your landmarks. Divide that space into 3. Do both sides. Next thing we're going to do is we're going to come down onto the cervical paraspinals, and all you have to do is, here's the middle of the neck. And even if I just push here, you see this paraspinal bulk, right? Paraspinals, upper trap, some levator scap, right? So what we want to do is, I want to feel that strand of muscles, okay? And then what I want to do is I want to come on the lateral side of it and squish it down onto the articular pillar. Would you grab that spine, or Iden, can you grab that spine for me? So we're going to smush it down onto the articular pillar so that we have a bony backdrop, which is the articular pillar of the spine. And there's really good pictures in your lab manual. I'm going to put this on the back. There's really good pictures in your lab manuals, okay? But when we come, this is like super scoliosis. When we come to the articular pillar, we're going to take our paraspinal bulk, that's like that, and then I'm just going to compress it down and towards the midline, right, onto the articular pillar. So now I know that what's underneath my fingers is muscle and then spine as a bony backdrop, okay? I think what we'll do is I'll talk through it. We'll do the suboccipitals first, and then we'll talk about paraspinals again, and then we'll come down. Because I'm sure we're just getting started. We can ease our way in a little bit slowly and do this in smaller chunks, okay? But we're gonna pin that down, and we're gonna needle it that way. And I'll show you guys what we're gonna do to make it perfectly safe and stuff like that, okay? After paraspinals, you guys are happy because now we're in familiar territory. Now it's upper traps, right? And you can just needle that muscle in one place. If you want to break it down into zones, zone 1 right by the neck, zone 2 kind of the middle of the body, and then zone 3 kind of out towards the edge. And if a patient is more hypertonic or tender in that zone, you can do that zone, or you can do all 3, okay? So
That feels great.
and then for levator scap, we know that at this top inner border of the shoulder blade, that's where levator scap attaches, and it is just going to run up onto the neck. So you could and into the neck. So we could say, there's our levator scap, right? On this side, we could say this is like upper trapezius, right? All of this, upper trapezius, right? So you can see how if we hit the paraspinals, we're gonna also hit upper traps and levator scap. You can see how if we get upper traps in this juicy little CT junction area right at the base of the neck, we can get upper traps and levator scap. So levator scap doesn't need like special attention according to me. If you want to give it special attention, find it where it attaches, squeeze it up off the body, and you can hit it there. But we've already hit it several places, so I think that's overkill according to me. So levator scap, upper traps, the paraspinals are in here. If you want to, with your little anatomy and stuff like that, you can kind of trace a little bit this upper border of the shoulder blade. Give yourself an idea of where that is in space. And in a little bit, you might want to untape one side and let us tape it later so we can, because we're going to be drawing shoulder blade and where our muscles are and stuff like that. But, so are you guys cool if I go ahead and show suboccipitals?
Yes.
And then we'll needle those?
Quick question. Are we doing the bracket?
Yeah. So we're gonna bracket each of the suboccipitals, 1, 2, and 3.
This is like the most common one we do.
Yeah.
We're gonna bracket everything except for upper traps, which will be a pinch.
And what's the direction?
I will show you. We won't talk about that. If I usually don't leave needles in, but for demonstration purposes, sometimes it's better for you guys. Do you mind if I leave in the needles?
Yeah, that's fine.
Just letting you know. If you're gonna do your needling and you don't want to have to sit around and wait, you can go ahead and open 1, 2, 3. You can get them open for yourself, right? So they're ready to go. 3.
If
Okay.
you're planning on going to them.
Yeah.
Right?
Yeah, exactly. So we just want to know, okay, occipital, what do we call it, shelf, like the occipital shelf where it falls off, okay? And if you move, once you find that shelf and you can curl your fingers back up onto it, then you can just kind of wiggle around. If you guys look under my finger, there's a big old tendon that's inserting there. So what I'm going to do now is I'm on the inner side of that big old muscle and tendon, I'm gonna bracket the other side of it. I'm gonna put my needle right onto the occipital shelf, and you guys see the angle of this? So we're not going towards spinal cord, we're not going towards vertebral artery, we're coming straight up as vertical as you can. I would say, as long as if that's 90 and that's 45, I definitely want you to be under the 45, like between 0 and 45 is ideal. So if sometimes you have a big body and stuff like that, make adjustments. But so tap.
Oh.
And this is a pretty shallow needle. It's skin, suboccipitals, bone. There's not fat, there's not subcutaneous tissue, there's not a lot going on here.
How does that feel?
What I'll tell my patients is, relax for a sec. If you're good, we'll move on. If you feel like we need to take it out, you let me know and we can take it out. Are you good? Do we need to take it out?
I don't feel it anymore. So, be cool. I think. You're the expert.
It's if your patient stops talking or breathing, that's
Take it out.
Okay, so from the midline to the mastoid, you've got 3 zones.
Ooh, hello.
There's zone 2.
Same thing, you're in the straight up.
Same thing, straight up. All 3 of these are the same. We're just doing them a little bit next to each other.
What would happen if you didn't angle them properly? Would you just miss the muscle?
So, I'll tell you after we're done.
After she's
Bro, you gotta tell me when you're doing it.
And these are shallow, like we're talking like half a centimeter, right, to a centimeter. These are very shallow. You can see we're vertical. We've got zone 1, zone 2, zone 3. So if you put your, right, if you bracket, there's my half of the skull, I can go finger 1, finger 2, finger 3. And that's close enough for government work. You're gonna hit those suboccipitals, that's gonna take care of what we need to take care of here, okay? This is one of the places where you'll be a little bit more leery, but you are perfectly fine. Like, trust me, you're fine here, okay? So the rule is the needles have to be under 45 degrees. Reason being, if you angle them super anteriorly, you might bump into vertebral artery, which is not going to kill your patient, right? But you might give them a nice bruise and some soreness. Right, the needles are so thin, if you hit an artery and pull it out, the artery is just going to plug itself up like immediately. You may get 1 drop of blood. Okay, we don't want to needle that. And if we're in the middle of the spine and we needle directly anterior, you might make it through. Where's my spine at?
Right next to your foot.
Right there, right there. Lower.
All right, you guys can see what's hiding in between those vertebral segments. So we don't needle. I'll show you guys in a second how we're going to needle to avoid that, right? So we're not going to have the patient in extreme neck flexion. We want them to be neutral. And then we're going to needle from lateral to medial. And then we're going to needle inferiorly. So you can never get into the spinal canal. You guys know what the dura mater is? The tough mater? Yeah, good luck needling through that thing. You guys wish. Have you guys ever seen an epidural? Go watch a video. Those guys are like, you're not gonna get through it with the needle. Good luck. Might as well like be needling a bone. Okay.
Steve, can you show the angle on this side too?
Yeah.
Is there a needle still in my head?
No, but it might feel like it, but no.
It does feel like it, yeah.
So we're gonna needle the paraspinals, not yet, but in a second. We're gonna needle anterior medial, and we're not going to needle upwards, right? Otherwise you'll do facet injection, or maybe you'll go into the spinal canal. We're going to needle inferior, okay? And that's going to help us to land on the articular pillar on the bone and stuff like that. So, okay, I want you guys, if you want to draw, you can. I don't feel like it's super necessary here. If you can visualize upper traps, levator scap, and the suboccipitals, we're fine. If you guys want help, you want to do some drawing, that's cool. There are places where drawing is going to be mandatory. Definitely the shoulder blade and some other places and stuff like that, so your choice. I want you guys to be able to needle at least one side of the neck, the suboccipitals. If your patient's cool and you're cool, go ahead and do 3 on this side and 3 on this side. All right, let's do it. Let's go get that practice in.
time or
Facelift.